Hi everyone, Dr. Byrne here from Revive TV. On this week's episode, we are going to talk about headaches. And because this month is all around neck pain and neck related symptoms, we're going to discuss how you can work out whether your headache has a neck problem as its origin. As a chiropractor, you could imagine we see a lot of people with neck pain and headaches. And so one of the most commonly asked questions of people when they come in is, what is causing my headache? And it's not usually as simple as one thing, because mostly there's multifactorial. Could it be stress? Could it be a reaction to foods, like an allergy type of reaction? Could it be hormonal? Could it be a structural problem with my neck or my spine? And the answer is yes, it could be all of those things. But the ones that we have greatest success with, and the people we can most likely help, are people who have what they call cervicogenic headaches. Cervico is another name for neck, so cervical is the neck, and genic is origin. So cervicogenic is neck in origin with your headache. So today we're going to discuss how you can work out at home whether potentially your headaches have a cervicogenic origin. For us in our practice, we would, through our history taking, we can get a pretty good idea as to whether they are cervicogenic or related to a neck problem. And then through our testing and other things, we can very quickly diagnose whether we think we can potentially help. But for you, there are 5 things that you could do to check whether you have a cervicogenic headache as probable reason for your symptomatology. And the first one is it's worse on one side or it changes sides. So if you've got we call a unilateral, so it's one-sided headache, the reality is it's probably coming from a neck problem. The second one is if it exacerbates with trauma. So whether you had a trauma and it comes on, or whether even from exercise, whether you have a lot of sudden movement with exercise, whether you feel like your headaches come on with movement, then it's likely to be a cervicogenic headache. Third one is, do you have neck pain or stiffness associated with the headache? So when you have your headache, do you feel like your neck is a bit stiff or there's some pain in there as well? The fourth one is the medications. The medications don't work like they did at the start. So the medications at the start were getting rid of the pain, but it hasn't actually addressed the cause of the problem. So if that's not getting rid of it, then there's probably an underlying cause, and most likely coming from your neck. And the fifth one is being in a position for too long, especially say sitting. So if you're an office worker and you get headaches, and especially if you notice it as the day progresses that they get worse, it's more likely to be associated with this neck position, that the muscles, as we sit in this kind of forward head posture that we've talked about a little bit over the last few weeks, the muscles that hold our head up have started to just kind of get fatigued and not work, and all of a sudden we're getting this pain into our neck. Now, one of the questions some people ask me is, how can my neck problem shoot pain into my head? Well, there's a little nerve called the trigeminal nerve. I don't expect you to remember that, but its origin is in the upper part of the neck. And there are some of their fibers intermingle with other nerves exiting the upper part of the neck. So there's C1, C2, and C3. That is simply the first 3 bones in your spine. And sometimes this trigeminal nerve, well, not sometimes, they interconnect with these other nerves that come up from this part of our neck. And the trigeminal nerve sends sensory input to all our face and our head. So with this kind of interconnection, there sometimes can be this signal into our heads, this great pain, but it's actually coming from the origin of the neck. So as a chiropractor, I would be assessing the neck to see whether there seems to be a lack of movement or incorrect movement as part of one of our things that we do when we assess you. So from your end though, if you can't get in to see a health professional, just think about those things. 1, is it worse on one side or does it swap sides? 2, does it come on with exacerbated by trauma, whether it's with just doing exercise or quick movement of the neck? The third one, is there neck pain and stiffness associated with the headaches? 4, the medications don't seem to be working like they used to. And 5, do you notice it as the day goes on that you start to fatigue or you're in a position for too long that the headaches come along? I hope that helps you determine whether you've got cervicogenic headache, especially if you have those things. I think the best thing to do is to go and visit a health professional, whether it's a chiropractor like us, an osteopath, or a physiotherapist that you have that you trust, but getting to see someone who can help you assess whether you do have those things. Thanks for watching this week's episode, and I'll see you next week for another episode of Revive TV.